was taken out of my kidneys this morning. I will tell you, having a number of bouts with kidney stones, this is what it feels like. And Dr. Hong, you know it's only a slight exaggeration, right? Did you bring these, by the way, as demonstration models?
Well, you know, these, instead of actually taking it from your body, I decided to take them from my backyard. But they actually kind of look like this when they're inside your body.
And they are so much bigger than anyone ever thinks until somebody brings down an actual sample of one of those babies. And they're ugly and jagged and painful.
Yes, they are painful. I don't know this personally, but I hear that they're worse than the pain of childbirth.
I have been told that, but not by every woman. See, women still hold out the possibility that they're the ones who go through the most pain. But women that I know who have had both said they would rather have a baby. How could I have prevented mine? As you know, you're my urologist. We invited you down here knowing my case and the many times that I've had to go in. But how could I have prevented it?
You know, ultimately, here in Arizona, we deal with kidney stones so often, and that's primarily because we become dehydrated. And you hear from your doctor all the time. You hear about drinking more water. We never think about, well, why do we have to drink more water? One of the biggest reasons is to prevent kidney failure and kidney stones. Kidney stones, number one, number two, and number three reasons why we form kidney stones is because you become dehydrated.
Okay, I'm drinking coffee right now. Does that count?
I'll let you have your 1 cup. I'll let you have your 1 cup, Pat.
Why? Because of the fact that there are negative aspects?
Well, you know, when I talk to my patients, such as you, and we talk about what to drink, I always say water is the best. Water is the most neutral, and it gives you that hydration, and it doesn't have other compounds that might actually make stones worse. For
like
example,
vitamin C?
Well, you know, there was a new study that just came out, and that's why I brought this thing in, because, you know, vitamin C is great. We need it. We need it. Well, sailors needed it to prevent scurvy when they were crossing the Atlantic a long time ago.
And you know what? Since I've been seeing you in your office, I haven't had one problem with scurvy. See, this is the kind of miracle man that Dr. Hong is. Located, by the way, where?
We have 2 offices, one in downtown Phoenix near St. Joe's Hospital, and our brand new office at Desert Ridge.
So what about the doctor? What about the doctor prescribing vitamin C for other things? Do I have to make a decision then?
It's very controversial, but I know there's a lot of people out there, and you know who you are. I won't make you admit it, but you're taking high dose of vitamin C. When I say high doses, well, it seems like a normal dose. I picked this up at the supermarket yesterday. This is 1,000 milligrams of vitamin C just from your normal dose. Now,
what should my daily intake?
Your daily intake as a man is 90 milligrams. So we're talking about a huge magnitude of excess vitamin C that you're getting just by picking up what's normally available at the store. You may not know that everything we do in medicine has risks and it has benefits. And we think that the benefits are to prevent colds and things like that, but the truth is, you're putting yourself at risk for kidney stones, and a new study has reinforced the notion that this is actually true.
And I know there are a whole variety of treatments because I've had most of them.
That's
so
right.
Please, if you will, as the doctor, talk about what it is that you do and other specialists in your field do when people find out, wait a minute, hold it, this pain isn't going away, and you find out you've got kidney stones.
Right. Well, you know, Pat, our overall philosophy at Affiliated Urologists is to try to prevent these stones because prevention is worth more than the cure.
A lot of water.
That's right. Now, as far as treating the stones, though, for example, this morning when I went up and took this out.
Yes.
And you look great, by the way, for having operated
well,
this morning.
Well, look what happened, for crying out loud, when you found out that you could get rid of these. I'm feeling fine. But what about the fact that there are people who are saying, I got him, now what?
That's right. When you got him, you need to take care of him quickly because your kidney is getting blocked up and you're at risk for kidney failure. And this being National Kidney Month, yes, we always have to think about that. The least invasive method is to shock it from the outside. That's something called an ESWL, very relatively painless procedure. And
Is that lithotripsy?
that's lithotripsy. The term itself means to break up stone. So ESWL stands for extracorporeal shockwave lithotripsy. I want you to say that 10 times fast.
No, what I'm going to say is that I have had that done. I wasn't aware I was under, but they're sending shock waves of some kind to your system. And I was asked yesterday if people still sit in that vat of water, but that was a long time ago.
That
right?
was the original lithotripter, and now we have more modern methods to achieve that. What we do is we send ultrasound waves through your body, and they basically breaks up the stone from the outside. It's a bit of magical machinery that's been around for decades, very safe, and it's very effective.
Does it always work?
Unfortunately, not for all stones. A lot of our success depends on how big the stone is and where it is in your kidney, or at any point between your kidney and your bladder, which is the tube called the ureter. And so my treatment plan is meant to be as minimally invasive as possible, but maximally effective as possible. It's matching the right tools to the right job.
All right, so there's that procedure. There are others.
Yes. Well, another way is to just go up there directly. Again, no incisions, but that's called a ureteroscopy, where we go up with this very small camera up into the kidney from below.
We are depending on the phrase, a very small camera.
Well, listen, you're asleep, so you don't know, but yes.
Just the whole idea, we're going up there and we're going to retrieve the kidney. And guys are the worst. Women, for some reason or other, seem to manage to listen to those kinds of things and say, oh, well, that's interesting. And guys are just cringing, right?
As a urologist, I have to admit, the men are a little bit more sensitive about this.
And by the way, if I had been born anywhere else in the world, might I have avoided this more easily and more readily?
Well, there's no question here in the desert, we just get more dehydrated because we're sweating more. So it turns out that we have what we call the stone belt. Now, the stone belt in this country also encompasses the south and the southeast. But why is that? Because we didn't even get to some of the other factors, such as diet, that do play an important role in stones and stone prevention.
Dr. Mark Hong knows whereof he speaks. He sure better, because if I got a pain back here, I'm on the phone right here with Dr. Mark Hong. 2 locations in the Valley. We only have one. Here at AZTV, it's called The Morning Scramble every day.